Anthony Avila, Doctor of Physical Therapy. Are you scheduled for a knee replacement coming up? Do you have knee pain? Are you using a walker or a cane? Then this video is for you. And it's going to show you exactly how you're going to get through the phase of going from using a walker to getting back to walking without a device. So this is the top exercises I use to help my patients transition through that phase as quickly as possible. All right, so the first one is step 2. So you're going to use your strong or your non-affected leg to step backwards, and then step 2, your operational leg or your knee that's in pain. So step back, step 2. All right, so here we've transitioned from a step 2 to a step through, and you're using again your off leg or your unaffected healthy leg to drive from a heel to a toe stepping through pattern on your affected leg. So you can see she's rocking back and then rocking forward, stepping all the way through. Okay, so the next phase would be to add a cone, or if you're at home, you may use a little styrofoam cup. You're rocking back on your heel, stepping over, and then returning back to your starting point. Rocking back, stepping over, finishing through the toe, and coming back to your starting point. All right, so here's the last and final phase as I'm returning a patient through a normal walking pattern, and it's a step over, and you're doing it facing the opposite direction this time. So now you're using your affected leg or your surgical leg to step over the cone as you're rocking back and forth. All right, so the number one thing to remember when you're going through these exercises is safety. You want to make sure that you can perform these safely. So in your home environment, again, at a counter height, protecting yourself. If you're not ready for these exercises, talk with your therapist and they can show you how and when to transition through this process. So again, these are the top exercises I use in transitioning my patients from a use of a walker to a cane to no device and getting you back to a normal walking pattern. So you can practice these. If you're scheduled for surgery, you can actually start practicing them now before you have the surgery, and that'll help integrate the systems in play for after surgery so that you won't have to go through that learning curve, and it'll just speed up the process that much more. So if you have any questions, feel free to reach out to me. Contact me 361-500-6686. I'd love to have a conversation with you if you have knee pain or you're scheduled for an upcoming knee replacement.